Well, good afternoon, everyone. Thank you, First Lady. To echo what's already been said, I am deeply humbled and grateful to be a part of this panel discussion and be a part of this gathering as a whole. Dr. J, you put so much out there that applies so much to the healthcare setting. I'm in population health here at BB Healthcare, and I've had the pleasure and privilege of being in this role as community services manager. I've always had a propensity to want to be of service, to be of service. This role offers me that opportunity, and I have the great support from the organization to literally meet people where they are. And we often think of that as geographically, and it expresses itself geographically often, but I'm also a big piece of that is really meeting them where they are psychologically, emotionally, spiritually, mentally. And most recently our vaccination efforts through the bookmobile process has afforded us those opportunities to really listen, to really engage with individuals, and not just around that subject matter, but around many subject matters, because we're right there in their community. So there's quite a bit going on in the healthcare landscape, as I'm sure many on this meeting could attest to. But some areas that are of focus here at BB is, we're really beginning to look at that relationship between trauma, those high-risk behaviors, and how that results in those poor physical and behavioral health outcomes. Once our providers become more knowledgeable and educated and are better able to understand the potential root cause of disease for their patients, they can help them better manage, engage with them, but also to help them better manage those behaviors, leading to improved health outcomes and that ability to self-manage. Trauma-informed approaches to care have shown so much evidence in not just increasing the patient satisfaction piece, but also that provider satisfaction. I think sometimes healthcare workers, healthcare providers might experience some challenges, and equipping them with the knowledge that's available through trauma-informed approaches doesn't just foster a deeper level of connection, it also allows for more insightful connection to resources that might be needed by those individuals. It supports our efforts. We've been able to launch a mental health telemedicine component. So it certainly is proving to be a very viable avenue to further our work in the trauma-informed space. This trauma-informed work also helps us develop strategies to address some of what might be our most frequent utilizers, and really looking at, First Lady spoke to social determinants of health. The more that we can open our lenses to encompass all of those considerations, and then weaving in that trauma-informed approach to care, the more likely we'll meet with success in supporting that patient to their highest potential outcome. And, again, looping back to you, Dr. J, this allows us to really address those health disparities. COVID has certainly afforded us the opportunity, a glaring opportunity, to become more intimately aware and informed of our community's challenges, of the members in our communities and what they encounter. And we've been able to pivot and address those in ways that we had not before. So there was an agility that we were able to embrace that was necessitated with the rapid development of COVID, that won't be lost. We will continue to acknowledge our ability to be that agile as we move forward in our trauma-informed work. And also anticipating this second wave, which it's no longer anticipation, right? It's been here. in the community. It's been here in our healthcare providers and our fellow team members in healthcare. Just the experiences they've had over the last year regarding what they might perceive as physical safety, and legitimately is physical safety if we look very, in the microcosm of PPE. But I also question how much that was psychological safety and environmental safety, and how that culture of safety, such a guiding principle in trauma-informed work, how that culture of safety was compromised or not present through their perception, regardless of the efforts that were in place. So I could continue to go on and on, but I know one of the most important pieces that Julia, you mentioned as well, is that self-awareness. So in our trauma-informed work and the healthcare setting, I think it lends a greater likelihood of that self-awareness, which is going to serve all of us much better, whether it be patients, coworkers, self, family, community. That increased level of self-awareness serves us all. So thank you again, deeply humbled and honored to be here.